I'm pregnant and I've developed a headache. Should I be worried? I know this is a question that so many pregnant women around the world may be wondering and asking themselves. So if you're pregnant and you have a headache, especially if you're someone that doesn't suffer from headaches, you've suddenly developed this new headache, yes, you should be worried. You should get checked up or checked out by a doctor, irrespective of what your medical history is. There are two things I'll mention that should make you worry, or that we doctors will want to make sure it's not, especially if you're pregnant and you have a new headache. Number one, pre-eclampsia. Pre-eclampsia, to put it simply, is high blood pressure that develops in pregnancy. From 20 weeks of pregnancy onwards, high blood pressure developing. Usually when we check your urine, we'll find proteins in your urine. Some people might have leg swelling, finger and hand swelling, and some other symptoms. We want to make sure you don't have pre-eclampsia, because if you have pre-eclampsia, it has to be treated. If you have pre-eclampsia and it's not treated or it's not adequately treated, then obviously it can progress to what we call eclampsia, where the pregnant woman begins to have a convulsion or a seizure. And obviously that can be life-threatening for both the mother and the baby. So we don't want that to happen. So if you're pregnant, you have a headache, new headache, see your doctor immediately. You want to make sure it's not pre-eclampsia. Now, what are some of those things you will notice in your body that might tell you that, okay, maybe you have pre-eclampsia, or maybe you already know you have pre-eclampsia, and then you want to know what are those signs or symptoms you experience that might tell you that you might be almost developing an eclampsia, a convulsion. Number one, blurring of your vision. Number two, you might develop pain in the upper part of your tummy, especially on the right side. So if you notice these things, you already have high blood pressure, or your pregnant headaches, blood, you start having blurring of your vision, or you start seeing flashing lights in your vision, or floaters in your vision, uncomfortable sensation in your vision, tummy pain, you start having nausea, you start being physically sick, vomiting, feeling very unwell, worsening of your headache. You need to rush to the hospital immediately, or preferably if you have access to emergency teams like ambulances, emergency response, I would say dial 911. If you're in the US, 999 UK, or the relevant emergency ambulance service contact in your respective countries. That's what you should do. If you don't have ambulance access, let someone drive you to the hospital. Preferably don't drive yourself, just in case you have a seizure or a convulsion while driving. So when we see a pregnant woman, we've assessed her, we've checked her blood pressure, we've checked her urine. If we say she doesn't have pre-eclampsia, but she's having this new onset severe headaches, and the next thing is that we want to make sure she doesn't have a rarer condition, which is called a sagittal sinus thrombosis. Simply put, blood clot in the vein in the brain. Pregnancy increases your risk of developing blood clots. It means your risk of your blood being thick, what we call hypercoagulable states. So even though it's not common, it's something we want to make sure has not happened. Blood clots in that big vein that runs at the top of the brain. So there might be a need to do a CT scan of your brain to make sure that you haven't got this. But the most important thing we want to make sure you haven't got, first of all, is pre-eclampsia, which can increase your risk of having convulsions, eclampsia. So if you're pregnant with a headache, please take it serious, see your doctor, and make sure you follow up on that. Don't ignore it.